Hello, my name is Demetria Woodruff, and today we're going to be talking about Parkinson's disease. The objectives for Parkinson's disease is knowing the etiology of Parkinson's disease, understanding the clinical manifestations of Parkinson's disease, knowing the complications associated with Parkinson's disease, knowing the diagnostic studies for Parkinson's disease, knowing and understanding and knowing how to treat a patient with Parkinson's disease with the drug therapy and also surgical therapy and their nutritional therapy. And the nursing management for Parkinson's disease, so knowing how to treat them and what nurses will do to treat patients with Parkinson's disease. So, for the literature review, up to 1 million Americans have Parkinson's disease. 60,000 are diagnosed each year with Parkinson's disease. Parkinson's disease is more common in men than it is with women. And knowing the importance, Parkinson's disease is important because as nurses, we need to identify ways to help prevent Parkinson's disease, how to care for the patients that do have Parkinson's disease, and how to prevent people that do have Parkinson's disease from it getting so severe. So you may be wondering, what is Parkinson's disease? Well, Parkinson's disease is a chronic, progressive, neurodegenerative disorder characterized by bradykinesia, which is slow movement, tremors at rest, so you can have tremors of the hands, or they can be persistent, increased muscle tone, which is rigidity, and you're going to have gait disturbances. So they can have shuffle gait, they can be unbalanced, it can be small steps. Now, the etiology of Parkinson's disease. So, Parkinson's disease is very unknown, and the cause is unknown. But it can be caused by the lack of dopamine. And dopamine is a neurotransmitter. The normal functioning of extrapyramidal motor system. So, your dopamine, it controls your posture control, support, your voluntary movement. And degeneration of dopamine producing neurons in the substamina nigra of the midbrain, which disrupts the normal balance between dopamine, acetylcholine, and the basal ganglia. Rigidity. Risk factors: well water, pesticides, herbicides, industrial chemicals, wood pulp mills, and rural residents. So people that live in a rural residence can also have these problems. So the clinical manifestations, they use the word trap for the mnemonic. So a trap in the park is a way that you can remember Parkinson's disease. So T stands for tremors, R is rigidity, A is akinesia, and P is postural instability. So T for tremors. Tremors are the first sign that you're going to see. They're usually the first signs that you're going to see also. Tremors have a way of affecting handwriting, and they also can have a way of affecting a patient or a person gripping something, trying to get something. Is more prominent at rest time, and it causes emotional distress. And I say this because just being, they can be frustrated from trying to write something and their tremors are happening, so it's making them look writing sloppy, or they can write something and then they can go up, so it's going to mess up everything, so you have to keep writing and trying to, and it's very frustrating when when you have to keep trying to do something and you can't do it. Rigidity, increased resistance to passive motion with the limbs are moved through their range of motion. It's like a jerk movement. So for rigidity, they can complain of their muscle soreness. They can feel very tired and achy, pain in their head, their upper body, their spine, and even their legs. Akinesia. So akinesia is the absence or loss of control of voluntary muscle movements. It can be bradykinesia, so bradykinesia is moving slow. Their postural instability. So they're unable to stop themselves from going forward, what is propulsion, or going backward, which is retropulsion. So, just think of yourself if you're rocking, you know how sometimes you can rock forward or you lean forward. That can happen. Or going backwards, they're going too far back. Some complications with people that do have Parkinson's disease. Some complications can be motor symptoms, weakness, neurologic problems, neuropsychiatric problems, dysphagia, and malnutrition. I say these are some complications with a person that has Parkinson's disease because malnutrition. Sometimes they're unable to swallow, which is, dysphagia. They're having a hard time getting all the nutrients that they need. Neuropsychiatric problems, you're lacking dopamine. So with dopamine, those do cause some psychiatric problems. Neurologic problems with the tremors, weakness, they feel very tired, all this, excessive movement that's happening. Their motor skills are being very impaired. Diagnostic studies. So what can help us identify a person that has Parkinson's disease? It's based on the patient's history and clinical features. So, you want to do a history, you want to do a physical assessment on the patient. So, finding out, are they having any tremors? Are they feeling tired? This can all help you diagnose a patient with Parkinson's disease. Confirmation of Parkinson's disease is positive response to the anti-Parkinsonian drugs. So, levodopa and a dopamine agonist. So, in the next slides, I'm going to mention to you, teach you, about the drugs that are used for Parkinson's disease. So, for drug therapy, the drugs are used to correct the imbalance of neurotransmitters within the CNS. The drugs that are going to be used is your anti-Parkinsonian disease drugs. These drugs are used to enhance the release or the supply of the dopaminergic, antagonize or block the effects of overreacting cholinergic neurons in the striatum, your anticholinergic drugs. The primary drug to treat Parkinson's disease is levodopa with carbidopa, cinnamon, chemical precursor of dopamine, can cross the blood-brain barrier. It's given in the early disease course for the management of motor symptoms. These are the different drug classes that can be used for Parkinson's disease. You have your dopaminergic drugs. Your dopaminergic drugs can contain dopamine precursors like levodopa. Dopamine receptor agonists can be, parladel. Your dopamine agonist can be amantadine. Your anticholinergic drugs, cogentin. Your antihistamine drugs, diphenhydramine. Your monoamine oxidase inhibitors, that can be your elidepril, and your catechol O methyltransferase inhibitors, that can be your Tasmar. Now for your surgical therapy, if there nutritional therapy can be needs for foods can be easily chewed or digested. You want them to eat small meals, so eat 6 times a day, and diet should contain adequate fiber and fruit to prevent constipation. So what would you do? The nursing care. You want them to have good health, encourage independence, and avoid complications such as falls or contractures. So, you want to do range of motion, teach them good things to eat, make them feel very independent, promote physical exercise, and prevent falls. I've got my reference and I've got them from our med search book. And do you have any questions? Let me know. Thank you.